Hello, unfortunately, obviously not great news if you've been following all the corona, COVID-19, NCOV-19, whatever you want to call it, disease. It's in most countries now, it would seem, around the world with community spread. So what that means is obviously people who have not been to China recently or anywhere like that have somehow got it and then spreading it around to other people. Now, I thought what we do in this video is go over a very quick history of it, sort of who's at risk, who isn't, potentially, because again a lot of this information isn't all known and sort of done and dusted yet. It's a developing situation and what you can do to try and avoid it. And if you do get it, you know what to do and what not to do. So, coronavirus, it originated in China in a city called Wuhan. Now, whether or not, again, I'm not going to speculate in this video, did it come from, you know, a wet market, did it come from a biolab, who knows. No way of knowing that now, but the point is, it's out and about. So basically, it spreads via the mucous membranes and sort of sneezing and coughing and things like that being inhaled. So it seems to be, to some degree, airborne, even though it's mostly droplet-borne. So basically, if somebody coughs or sneezes, it flies around and it will live on a surface for, they think, up to 9 days at this point, if not exposed to sunlight or sanitizers and things like that. And obviously, if you get it on your hands and touch your face, then it can get in that way. So it started spreading from person to person. And what makes this so infectious is that basically most diseases, you don't start spreading them until you're coughing and sneezing everywhere and you're visibly sick. With this, it can basically, you can have a week to 2 week, roughly, incubation period for most people. It can go up to 27 days, where you don't feel ill at all, but you're actually breathing out basically the virus microns and infecting other people with it. And then all of a sudden you start feeling really ill. So if you're lucky, you'll feel like the flu, and 4 out of 5 people will feel like it's the flu for them, basically. They will feel like, you know, just headaches, achy, you know, fever, that sort of things, cough, dry cough. But unfortunately 1 in 5 people will need hospital treatment, and this is where it gets to be dangerous. Because if you have 1 in 5 people who are infected with an incredibly infectious disease that need hospital treatment or they will die, lots of those people are going to die just simply because hospitals are going to be overwhelmed. So it's sort of the job of everybody now, wherever you live in the world, to try and observe as good hygiene practices as possible to slow down the spread of it, because if we're assuming that the spread is inevitable, what it has to now be is basically mitigating the damage it does or the speed it transmits, so you know, medical services are more able to deal with it. So basically, when you cough and sneeze, always cough and sneeze into a tissue. If you've not got a tissue, cough and sneeze into your elbow, just because it's not as bad as sneezing on your hands or just sneezing everywhere, and then, you know, touching things with your hands. Careful not to touch your eyes and face, easier said than done because we all do it as humans, but, you know, that's an easy way to get it into your body. Now, as regarding masks, lots of people say masks don't work, lots of people say masks do work. Completely depends on the type of mask. Obviously, I've been over that many times on this channel. But if you're going to wear a mask, what you want to get is a N95 mask or better, preferably better, but you want to get one of those sort of, like I've said before, P100, P3 filtered masks, whether it be a half-face respirator with goggles or a full-face respirator, if you're either caring for people who might be sick with it, or if you're going on lots of public transport. Because obviously if you don't get it, then you can't spread it on to other people, whereas, you know, if you don't take any precautions yourself and you get infected, you could potentially be spreading it for like a week or 2 weeks to other people before you even realise. So, this advice will depend on what country you're in. In the UK, if you suspect you have it, you're to phone 111, and the reason is that basically don't go into an A&E department, don't go to see a doctor, because you risk spreading it to them and other patients, and anybody on the public transport route you've been on in that period. What you want to do is basically go into phone 111 and they'll advise you what to do next. Basically they can do a test which is generally swabbing your throat, I believe, or swabbing part of your nose, and that will tell them if the virus is in your system. So that's what you obviously do. Now obviously if you're infected you would avoid as many people as possible. Also be very careful if you've got elderly or sick relatives, just simply because, you know, they're a lot more vulnerable if they catch it. Now, another thing to note is because this is inevitably going to lead to panic buying of both food and sort of pharmacies are going to be in short stock of supplies, you're going to want to make sure that when you're doing your daily shopping at the moment, or weekly shopping, whatever, you are putting a bit more on the shopping list than normal and coming up with a plan of stuff you would need. Just because I think a lot of people are going to leave this too late and then really panic buy where they're trying to clear out shops. We're seeing that in some US states now. That's been happening in Italy. You know, there's lots of videos in Asia of that happening. So, you know, the most sort of important thing is just keep aware of what's going on and take precautions as and when you need to take it. Unfortunately, it does seem like the stage now where containment is being lost everywhere, because if you just see the rate it's spreading in Italy and South Korea, it's clear then, you know, they've lost control of it. So basically, just be prepared to deal with it yourself. Don't believe anybody who's being an idiot and saying it's just the flu, because unless you're going to compare it to the Spanish flu, you know, one of the worst flu pandemics in history, it's a lot more infectious, and 1 in 5 people requires hospital care, which, you know, is much worse than the flu. You know, 20% of the population, if they caught the flu, wouldn't need to go to hospital, they would die, potentially. So there you go. Thankfully, the mortality rate does seem only about 1%, however, a lot of this is totally dependent on hospitals not being overwhelmed. If hospitals get overwhelmed, then that mortality rate could be the full 20% of people catching it. So, there you go, that's some info on it. I hope it's all been condensed nicely into one video. Obviously I'll be doing more streams and videos regarding it, but over the next couple of days I kind of want to do some more Geiger counter and gas mask videos, just because that's what I normally do on this channel, but these videos are more popular, so there you go.